Good morning. My name is Theresa Whiteside. I'm the clinical resource nurse for the chemotherapy treatment room and the urgent care center at CancerCare in Manitoba. I would like to thank the community oncology program for inviting me to speak a little bit about chemotherapy and radiation therapy. I have no disclosures, and I have no potential mitigating bias. In preparing for this presentation, I have considered the health equity resource for presenters provided by the Conference Planning Committee. It was provided to help reflect on how these topics and content can have good effects or bad effects on people or populations that are underserved. Some things I'd like to cover this morning are to understand the basics of how chemotherapy and radiation therapy are effective in treating cancer, to learn some of the common side effects of chemotherapy and radiation treatment, identify self-care strategies when common side effects occur, and describe items that should be brought to the Cancer Center for your appointments and what will happen at these appointments. Just to give you an overall about CancerCare Manitoba, we have 4 systemic therapy units in the city. McCharles site, which is next to the Health Sciences Center, has 30 chairs and is the only site for radiation in the city. Taché site has 14 chairs in St. Boniface Hospital. Victoria site has 15 chairs in the Victoria General Hospital. And the Grace site has 6 chairs in the Grace General Hospital. As well, we have 16 community oncology sites so that we're able to provide chemo to patients that live outside of Winnipeg. And we also have the Westman Cancer Center in Brandon that offers systemic therapy and radiation treatment. We refer to everything as a chair in our center here at the McCharles site, but we also have beds that are available. So some patients prefer beds. Sometimes you're just assigned a bed depending on what is available at the time. Chemotherapy is delivered intravenously, subcutaneously, intralesional, inside organs, and orally. Immunotherapy or targeted therapy is delivered intravenously or orally, and radiation targets tumors or lesions, which is delivered externally to very precise areas of the body. Chemotherapy is cancer treatment that affects all blood cells. It can't distinguish between the good cells and the bad cells, so therefore it attacks both. The effects of this are low blood counts, which can lead to anemia, low platelet count, which can cause bleeding, and a dangerous condition known as febrile neutropenia, which I will address in a few more slides. Immunotherapy is a cancer treatment that stimulates the immune system to attack cancer cells. Sometimes the immune system gets overstimulated, which can lead to lung problems such as pneumonitis, thyroid problems, or gastrointestinal problems. It's important to have the alert card with you to present to the emergency room or urgent care should any patients have these symptoms. The alert cards are given out in the chemotherapy treatment room or from the clinic nurse at the time of your appointment. These cards alert the providers that are looking after you that you are on a drug that can in fact cause some of these issues. Targeted therapy is a cancer treatment that targets the changes in cancer cells that help them grow, divide, and spread. It's often used in combination with chemotherapy or radiation. Radiation is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. The effect is not immediate. It takes days and weeks, and often the effects are there after the radiation has finished. It can be used in combination with surgery or chemotherapy, and it can also affect healthy cells. Some of the common chemotherapy side effects are nausea, vomiting, fatigue, hair loss, muscle aches, rash, nail changes, neuropathy, which is numbness in the fingers and toes. We've come a long way in treating nausea and vomiting since over the last maybe 20 or 30 years. So patients very seldom experience vomiting, and their nausea is usually quite well managed. We do encourage them to contact their clinic or the urgent care if they find that the medication that was prescribed to them isn't working as well as it should. We have other medications to try or just to offer some advice on how to take the medication. Fatigue is common. We recommend if you're tired, you rest. We do recommend trying to get some exercise every day. It's been proven that short, amounts of exercise, 20, 30 minutes of a walk or a late workout actually helps recover from the chemo. Hair loss, very distressing for most patients. We have a wig room set up through the Family Resource Center. Patients will get a wig and 2 turbans for their treatment time. Few insurance companies often cover the cost of a wig. The doctor just has to write a prescription. And so Blue Cross, for instance, usually covers the cost of 1 wig if you have that on your insurance policy. Muscle aches, we deal with as they come up. Rash, we encourage patients to call or present to urgent care for a rash. It's often related to one of the chemos that they have, but we do need to monitor the rash. Nail changes, again, a very distressing side effect. Nails will come back. There are some chemos that affect the nails where they will lose them, but the nails do grow back. Neuropathy, which is a numbness in fingers and toes. We do counsel patients on this. We need to know about it. So for instance, if patients are unable to do up their buttons due to numbness in their fingers, or they find that they're tripping over things because they can't quite feel where their feet are, that we need to report, because in fact the chemo dose may need to be adjusted to so that we don't do further damage with that. Febrile neutropenia is a fever signaling infection when the blood counts are at their nadir or lowest point. There's no defense in the patient's body to fight this infection. It can be life-threatening. So it's important to monitor the temperatures at home. Do not take anything that can hide or mask a temperature, such as Tylenol or Advil. You must call your care provider and report immediately to the emergency room or urgent care. This infection can take off very quickly in patients that don't have any cells available or in their blood to fight the infection. So this is a side effect that is reviewed quite frequently and stressed to many patients to monitor for this to happen. It doesn't happen in every patient, but it is a possibility, so we must be very well aware of this. Some other side effects, as I said, the nausea and vomiting. So we have new drugs that do prevent it. We recommend for the first cycle to take the prescribed medication as directed, whether you think you need it or not. It's hard for patients to distinguish the first time around sometimes. By the second and third cycle, they pretty well know what days and they're going to have a little bit more nausea than others. We recommend you keep Gravol on hand just in case. Better to have it in the house. And keep your fluid intake up. We recommend 1 to 2 liters a day for at least 3 days following chemo. Sometimes very hard to manage that. So again, if patients are not able to, we recommend that you call the clinic or call urgent care for some advice, or to come in actually, and we will give some intravenous hydration if needed. Hair loss, contact the Patient Resource Center. We have all of these phone numbers in the clinic or in the chemo room if needed, and it would be given out at the time of the first appointment. Tell your doctor about all your medications that you take at home, especially herbal and non-prescription remedies, as some of these may have some harmful effects when taken along with chemotherapy. The pharmacists will research all of the medications and make recommendations whether or not it is safe to continue with them, or if it is recommended that you discontinue them. So it's very important to bring everything with you and to report all of the medications that you're taking at home. Chemo brain or brain fog is another common occurrence during and after treatment. Poor concentration, decrease in mental sharpness, forgetfulness, disorganization, trouble multitasking, trouble finding the right words. It can be very distressing for patients, especially those that were working or are trying to continue to work, find it very difficult. At home, often trying to manage a household with children and activities and appointments and that. Very distressing. It does return. It takes a little while sometimes after chemo for the brain to clear. Grastafil and pegfilgrastim is a newer medication that we use with many chemo regimens to help your blood counts recover and also keep the patient on schedule. So it does two things. It does help to prevent febrile neutropenia, and it does help to keep patients on schedule. Many patients that are on an every 2-week or 3-week schedule, their blood counts have to recover from their previous cycle before we may continue with a second cycle. This injection is given in the abdomen or the upper arm. It may be 1 day or several days. Patient and family members are taught how to self-inject, and fever, bone pain, body aches are common side effects. And again, not every patient is on this. It really depends on the regimen and on patient's age and if they have any other underlying medical conditions. So a physician decides whether or not this is warranted. So just a quick review on some immunotherapy side effects. They're a little bit different than chemotherapy side effects: fever, chills, weakness, some nausea, vomiting, fatigue, muscle aches, headache. Targeted therapy side effects. Most common side effect is diarrhea and liver problems, but also fatigue, mouth sores, nail changes, high blood pressure. Some radiation side effects. Fatigue is common for all patients receiving radiation. And again, fatigue is not in the beginning of treatment, but more towards the end and after treatment is finished. Otherwise, the side effects really depends on the areas where the radiation is aimed at. So anybody undergoing radiation for brain cancer or brain tumors, memory issues would be something that they would see. Any area where it's going through the skin, there would be skin changes. Anything that might be in the upper chest or throat area, swallowing, very common problem. Bowel and bladder issues, fertility problems, sexual problems. The radiation, there is a nurse that works on the radiation floor. We refer to that as the RT floor, radiation therapy floor. And she is available, it's usually a she, I shouldn't say she or he is available to assess any of the side effects that may be occurring while a patient is on radiation. They have recommendations for lotions. They have dressing supplies for open wounds, and they can provide ongoing assessments to monitor condition of skin or wounds. What to bring to CancerCare? At present, only one companion is allowed for the first visit in the chemo room. Companions are allowed for physician visits and otherwise in the building, but in the chemo room at this time, we're only allowed one companion for the first visit unless it is a necessary companion. Patients who are visually impaired or need assistance, those are the exceptions. Bring your medications that you normally take at home, especially pain meds, because if you need your pain meds, you take them while you're in the chemo room. Bring a snack or food. CancerCare does not have their own cafeteria, but the hospital is close by. So if somebody can go and get something for you, a family member, and drop it off, that's allowed. Bring a blanket if you like. We do have blankets, but you're also allowed to bring your own. Bring an electronic device if you have one. Some patients are with us for the day. We do have Wi-Fi available. And bring slippers if more comfortable. We prefer patients walk with something sturdy on their feet to help prevent falls. So some take-home messages. Keep in touch with your care team. Have someone with you for important appointments. It's hard to remember everything, and a second set of ears is very helpful. Call your clinic for questions or clarification. Contact the urgent care clinic for any symptom or anything that might come up that requires a physician to look at in the next day or so. And we also have a psychosocial oncology department that have excellent social workers and people trained to help cancer patients go through this journey, help with families, and just overall support for the patients. Any questions, you can please contact your clinic team. They will be able to get in touch with me. They know me. I'm in the chemo room every day and know pretty well everybody in the clinics, and I'm more than happy to answer questions through them. Thank you very much.